Rheumatic and musculoskeletal diseases are among the world's most prevalent, disabling and burdensome non-communicable diseases. It is affecting more than 120 million Europeans, including children and young adults. However, despite high cost for late treatment and comorbidities, many European countries lack a sizable rheumatology workforce and knowledge of RMDs.
Denmark is an excellent example of RMD patient care. The number of rheumatologists per 500,000 inhabitants is extraordinarily high due to an excellent medical education. Every medical faculty in the country hosts a rheumatology department, with 3 even hosting a chair of rheumatology. In addition, the Danish model focuses on the principle of togetherness. Diverse healthcare professionals collaborate with rheumatologists in a multidisciplinary team to support RMD patients and offer guidance on non-pharmacological treatment options, such as healthy lifestyle, rehabilitation and self-management.
While the healthcare staff maintain their positions as experts, the patient's perspective is considered at every level. The multidisciplinary care facilitates the holistic approach to patient-centered care, where the patient is proactively involved in decision-making at every stage of the process, from symptom start to goal setting. Patients are thus quite active in Denmark, and so are the patients' associations advocating for their rights and needs.
A perfect example of this collaboration is the Dansk Gigthospital in Sønderborg, which is owned directly by the Danish Patient Organization. My team of rheumatologists works closely with professors for rheumatologic rehabilitation, Professor Jette Primdahl and Professor Anne Bremander, nurses, occupational therapists, physiotherapists, psychologists, as well as the patient organization, thus creating 3 equal support pillars within one hospital.
Denmark also excels in another aspect of accessibilities, providing patients appointments with rheumatologists quickly. There is a maximum 4 weeks waiting period for a new patient's access to a specialist appointment, guaranteed by the Danish law. Early diagnosis and treatment is crucial in making the patient feel well cared for and safe. Of course, there are differences in waiting times between different regions in Denmark, but it is still possible to talk to a specialist even when not getting an appointment right away. The patient is thus not made to wait for months for a necessary appointment.
So, what learnings can we take from Denmark's example? Even at hospitals not directly owned by patient organizations, patient-centered multidisciplinary care is the standard model in Denmark. The principle of togetherness gives patients access to information about their treatment and access to quick specialist appointments. Enabling patients to be surrounded by a multidisciplinary team addressing RMDs from different professional views from the start is a valuable way of building trust, creating treatment compliance, and preventing comorbidities further down the line.